Hi guys, Vik Vijh here, plastic surgeon. Now, as you all know, I'm very well known for fixing surgeries that have gone wrong. And I thought what I'd do is I'd give a little piece to camera about what to do if you think your surgery has gone wrong or your surgery isn't as good as you would have liked. So, first point of call, once you've had a surgery, you need to accept that it takes a certain amount of time for that surgery to mature. So there's swelling, there's edema, and that all needs to settle. So give the surgery a good 3, 6, even 12 months to settle. If it's obvious that things aren't the way you want them to be, your first port of call is your surgeon. Go back to your surgeon straight away. Go back early and say, look, I'm unhappy about this. This doesn't look right. And your surgeon will be able to reassure you. They'll be able to say either this is swelling, this will settle, or they'll say, actually, you're right, this isn't as it should be. And at least then they're in a position to say, okay, the steps we will take are the following. If you've done all of that, and either your surgeon's given you an answer that you're unhappy with, or they've tried to fix it and haven't been able to fix it, or some of them just say, I don't know what to do, and that happens a lot with me, and they'll send them to me and say, I don't know what to do, so go see Vik Vijh, he'll sort it out for you. In that scenario, what you want to do is you want to get yourself a second opinion. Now, getting a second opinion's a tricky one because you don't know who to go to. Ports of call. The hospital manager for the hospital where the surgery was done is responsible to make sure that they give you a name of somebody you can go to. And often they'll even pay for that appointment. Your GP. Your GP may or may not, because they don't always know, it's not something at the tip of their fingers, they may or may not know somebody who is very good in that area. The surgeon you went to might actually be honest enough to say, go see this person, I'll be able to help. When you get your second opinion, make sure the second opinion is somebody who knows at least as much or more than the first surgeon. There's no point in going to somebody who's just become a consultant and knows nothing. So, when you get your second opinion, make a decision. That second opinion might tell you that the surgery is good or bad. If you come to the conclusion that the surgery isn't as it should be, you now need to go through the process of secondary surgery. Now, the important thing about secondary surgery, and for somebody who does a lot of it is unlikely you will ever get a perfect outcome. It's unlikely you'll ever get a perfect outcome from any surgery, to be honest, because perfection is nigh on impossible. But you have to accept that you're now in a position of compromise. And what you're trying to do is you're trying to get to the best position you can. Now, often that position is very good, but as I know from experience, often I look at situations and I think to myself, I'm going to have to compromise here. I can't make it perfect, I can make it better though. And sometimes I say to the patients, I can only make it less bad. And sometimes I shrug my shoulders and say, I don't think I can do anything here. But what you do need is you need that good second opinion. And then you need to be clear in your mind that it's not necessarily going to be what you had in your mind in the first instance. Pick your surgeon carefully and have your surgery. Keep in touch with that secondary surgeon very carefully to make sure that you keep on top of any problems. Remember, complications happen. Surgeons talk about complications pre-op and we all hope we'll never get one, but they do happen. Even I get complications. We all get complications. So pick your first surgeon carefully. Do your research. Cheap and cheerful isn't always the right answer. Trust me, it's your body. Get advice from your GP. Get advice from people who've had surgeries. Do your research online. If it goes wrong, do the same process again for the second surgeon. And hopefully, fingers crossed, it'll all turn out okay.